And basically what this app does is gives the students an overview of pharmacology. And we say an overview, meaning a basic overview. This app shows flashcards for the students. It does flashcard reviews. You can choose between the number of flashcards that you choose for each type of medication category. I'll just start at the beginning. This is the front page when you go into the app. You can start a flashcard session, so we'll just click on that to give you an overview. And you can review medications by drug categories, the descriptions of the drugs, or you can even do it by drug examples. You can choose how many cards you would like to review, 15, 25, 50, 100, or look at all of the flashcards in that group. This app also gives you the ability to flag flashcards or flag important medications that you might want to go back and review at a later point in time. So the front page of your flashcard gives you diuretics, thiazide diuretics. And when you flip that card, it comes up with examples, descriptions of the diuretics, what is nice to know, what is good to know, and what is really important to know. So it gives you the top examples of these meds, okay? It describes these medications. And then there also is a complete drug index. There's a drug index divided into drug category and drug example. And you can click on these medications and it gives you a description, their basic uses, and some examples of the medications. Okay? But basically it does not cover a lot of information. It does not cover your nursing interventions. It does not cover important things that you might want to check on your patients who are on diuretics. What is their potassium level, monitoring their urine output, weight gain, weight loss, etc. It doesn't cover those types of things. It doesn't cover patient education. So those are some of the drawbacks that we found with this application. There's a weekly style, a weekly NCLEX style question. But again, here it doesn't give you any rationale behind it, which is really good for the students to understand why they got that question right versus why they got it wrong. Because a lot of the times they might pick a question or pick an answer. They weren't sure, it was just a guess, but I want to know why that is the correct answer to begin with.
Thinking, you really have to have the full picture for the student to really get instead of breaking it up on them like this, so they're going to miss some things. What we noticed on this here, the resource information is basically by the company who is backing this. So their books are the ones that they refer them to, not to the ones we're using. So of course then you would find conflicting kinds of things. There's nothing in there that also drops the medication into anything where they can think about it through the nursing process. There's nothing in there about what would you assess. How would you set for your nursing diagnosis and set your priorities, what type of interventions, kind of thing, and then that follow-up on education and evaluation. Was the top 200 drug quiz and card application, flashcards that we found for $1.99. That was not bad. We found the Davis Mobile High Alert drug cards. They were 99 cents. You get 132 high alert meds. Okay. Now this only shows therapeutic and pharmacological classes in the name of the medication, but it's at least more in depth, and it's from Davis, who has a very good drug book. Okay. So you get more of that style about how it's presented in the drug book with that particular app. And Symbaloo, the one that we were talking about.
Symbaloo. So it's a website that you go in and you create a profile, and there's these little squares all over the screen.
It looks like a honey grid kind of thing, doesn't it?
And you can
drop stuff into it.
Make little areas. So if you're teaching your musculoskeletal competencies, I have a cast care, I have a skeletal traction, I have a skin traction, I have pin site care. All of those videos, you can link them to YouTube, or you could link them to the school library's website to come up with videos for that. And it was very helpful, especially with the school library website. For instance, there are a few respiratory videos on there, so the students can actually listen to what do crackles sound like, what do rhonchi sound like, because they don't always hear that. And when they get to clinical, they don't know, well, was that rhonchi, was it crackles, I don't know, what's going on. So it's helpful for them to actually hear that.
So I found something that I thought would really help a lot with what we're teaching in psychiatric nursing. We talk a lot about cognitive behavior therapy. We also talk a lot about PTSD, post-traumatic stress disorder. And so I found something called PTSD Coach, which has applications, doesn't want to stay on, does it? Has applications throughout the semester because it had some techniques on there under managed symptoms, not just for veterans, but for children who've been abused, people who've been traumatized, people who've been in disasters, refugees. All over the world we're seeing people who are traumatized and react to that. So PTSD Coach was developed by the VA as something you could put on your iPhone, the person who feels they may have some symptoms, and they can work through a lot of problems. I went through all these categories. What is it, how it develops. There's a lot of information on there about PTSD and then about PTSD treatment. And people can do self-assessments. But I got all caught up in these neat little things they had on there, like they had a quiz about sleep, and it had all this interactive stuff where you click on the answer you think is what you're supposed to do for sleep and put it in the little box, and it tells you whether it's correct or not and all the reasons why. And it was really a neat kind of thing that I think anyone would want to play with. They did something about cognitive behavior therapy where they talk about events happening and you're getting angry or anxious or having automatic thoughts, and then your behavior, how that is after the event happens. And these are the things we teach about in class. And I even used this, how they had diagrammed it. I even used that in a class I did in my other job in Baltimore, and it worked fine. But now that I've gone through this on my iPad, I can't get back to this. I can't use it as a teaching tool. It isn't friendly in that way that you can show the same thing. You can go back to it and show it in class. You can't find your way back.
I just got this information from CHOP, the Children's Hospital of Philadelphia, who for over 10 years has worked with grant money on vaccines, information about vaccines. As a matter of fact, 10 years ago, Nursing Club, we still have some of the information sheets that we would hand out at the Jazz Festival or the Caribbean Festival where nursing students might have a presence and hand this paperwork out. Well, Vaccines on the Go is what has happened, how that work has evolved. And now it's an app that any parent, any nurse, any healthcare provider, any family member can hold on to and access. Clicking Vaccines will give you information on any number. You can do it by alphabet, or you can do it by the name of the vaccine. It really does put incredible information right at your fingertips. It can talk about the disease and how it spreads.
So, and this is what happens in class. I don't know if all of you are using clickers yet or not, but we've been using them quite a bit this semester, and we do find this out, and it makes for a very lively discussion as to why different responses.
So again, very interesting, and at this point we would throw it open to the class. Talk to me about the egg allergy. Come, let's discuss this. Or it's formulated annually. Let's talk about that. Now, frankly, sometimes we use questions that don't have the most obvious answer. I did that today. The students were really frustrated. They wanted to see a diagnosis, and instead I mentioned that it was part of Access 2 in psych in class today, and also gave a pretty value-laden example. I said that this particular case study person was manipulative, and the majority of the students chose that value-laden, that judgment, rather than realize that what they needed to do was see that it was an Access 2 diagnosis. And it was pretty interesting. We did it again. Before the answer was given, just discussing it, we repolled. So let's think about this. If you go to the website, or if you really do work in the area of vaccination, and if, as nursing instructors or allied health instructors, if we're talking to our students and they're saying, I'm allergic to A, and I will not get the flu vaccine, and it is pretty incredible to hear some of the reasons that students give for not being willing to adhere to a rule such as that one.
So as we look through the different apps, we found that Cerner Physician Express really wasn't appropriate for nursing students or for us as faculty. It was meant for access for physicians to their patients' charts if they're in a hospital, or maybe their chart in their office. So it really wasn't applicable to us.
Electronic medical record or mobile device, and it was for use by physicians, physician's assistants, and nurse practitioners that provided them to do documentation, paperless billing, and e-prescribing. So it was very beneficial to be able to have that, but again, that really wasn't appropriate for the educational purposes. It's a comprehensive medication formulary with a free version, and there also is a subscription version that provides additional information for the user. It's available for use on iPad, iPhone, iPod, or iTouch, and I'm sure there's a version for Android devices as well. It's very easy to use, and you don't really need to know how to spell the names of the medications. If you start, it'll narrow the search for you. It's frequently updated, so you truly have the more current information. Our drug books so quickly become out of date, and if you watch TV at all, you see almost every week there's a new medication, and patients are being started on those, and it's not in your drug book. So having something like Epocrates is very, very helpful.
Okay, this is the Epocrates app that has drugs, interactions, the pill ID, a provider directory, calculations, tables, essential, I guess I should read off my thing, essential points, contact manufacturers, and notifications. And the notifications at the far end, they pop up all the time, and you have numbers by your app, and you can go in and look to see what they're actually telling you about. What I did for the next couple of slides is I just threw up various PowerPoint slides from like 3 or 4 different lectures. Say to the students, tell me about this drug. And now they're actually whipping out their phones and they're looking up the drug information, so then I have more interaction in class.
And then they're supposed to use it to interact with this puzzle, which is a way then to learn the medications in a nice way. And this is just another, technique for getting them to remember the medications.
Just like what Ken and Catherine talked about with the flashcards, there's no nursing implications in Epocrates, but it helps narrowing down the focus of the medication.
One of them's bradycardia, but it doesn't say to the student, take the pulse before you give this medication, just like it doesn't tell me before I give a blood pressure medication to take the blood pressure, or to look for orthostatic hypotension. And a nursing student really needs that focus.
So this is pretty cool because this has a locator. And you can put in Largo, Maryland, and it'll pull up a number of, and it does blood, and it does urine, it does skin.
And this is actually all of them here.
Yeah, this is the whole thing. And so you can see how many people have what blood infections or what urine infections in Largo, in a radius around Largo, Maryland, which would be helpful if you were doing, epidemiologic study or research.
I feel like when I'm in clinical and I pull out my iTouch and look up the medication, I'm emulating professional behavior.